Western Cape Premier Alan Winde says the province appears to have reached its peak of the second wave of coronavirus infections. Winde says nearly 70 tons of oxygen are being used daily to treat patients. While the Western Cape Premier joins us on the line, on the Skype line. Premier Winde, good evening and thank you so much for your time. A pleasure to have you on. The Western Cape has been in the grip of this for over a month now, really, that you've been struggling with the resurgence of the second wave. Give us a sense of where we are, because in the last couple of days, the reports coming out of the Western Cape have been on and off in terms of whether you feel you've seen the worst of it.
Yeah, so as you say, it started off in the Garden route and now the whole province. But we've seen a decline for the last 3 weeks in the Garden. And then the same thing in the rest of the province. Our reproductive rate, the R rate, is coming closer to 1 now. We're seeing the test positivity rate dropping. It was sitting over 50%. It's now just over 30%. Our hospitalizations are still at a sort of leveling off level. We haven't seen those come down yet, but all the indications are that we're at the top of that curve. My message is that the top of the curve means that everything's full and at capacity. Everyone still has to play their part, because by playing your part, then we can only start to see it go down the other side. But so far, so good. We're quietly optimistic, and we're just asking everyone to still keep on making sure that we are social distancing, making sure that we are washing our hands, and we all know what to do. We've just got to keep doing it, and the system seems to be maintaining at the moment.
Premier, give us a practical sense of what being at full capacity actually means, in particular for the kind of resources that you're having to put out there, not just to sustain the current load, but of course to also make room in the eventuality that the numbers keep rising and don't necessarily breach below the 3,000 mark as you're well hoping for.
Correct. So, I mean, in our state sector, we've got 7,500 bed capacity. We're sitting at 3,500 beds with COVID-19. But bearing in mind, we've also got to have beds for everybody else. We've had to triage and exit many people out of the system that weren't critical, so that we could deal with the COVID-19. As you mentioned earlier, our oxygen use, we normally use around 12 tons of oxygen per day. In the peak of the first wave, we went up to 27 tons. We're sitting on 72 tons a day at the moment. We went over 80 tons at one stage a week ago. But we can see those coming down, but we've got to make sure we've got sufficient beds. We've put in quite a few extra beds. We've still got our field hospital with the 330 beds out on the R300, but we've been putting a lot of extra beds in our existing hospital system and near our hospital system, so that we can make sure that's because of the staffing issue. To build extra field hospitals means you take staff away from your key hospital spaces or clinic spaces. And so we try to add the extra beds in our existing system. And so far, so good. And we've still got another 130 beds that we can push the trigger on. We've just held it in abeyance now because it looks like we have sufficient.
There, of course, would also be a lot of interest, Premier, when we talk about these hospital admissions. What are the kind of figures that we're looking at? And I don't know if you would have them on hand, about the number of those who are treated in ICU or are put on oxygen and survive versus those who ultimately don't make it.
Okay, so I mean, I don't have the exact number with me right now, but we've got a very high rate of survival. But with the new strain, what we have found is that COVID-19 patients are needing more oxygen, and they actually need more days worth of oxygen when they are in our high care. That's why you see the volume of oxygen usage is so much higher than in the first wave. So it's longer days, but also the survival rate. And, we're learning all the time, even though it's a second strain or a different strain. Our hospital systems are learning how to deal. We pull people in earlier into the system. We work very, very hard with people with comorbidities to minimize their risk. So I think the health system itself is really, as I say, learning all the time. and trying to be as prepared as we can. And it really does look like we have reached it. But I never want to, and I always say to people, I don't want you to relax if we've reached the peak. The peak means that there isn't an extra hospital bed for you, so you need to be doubly cautious right now because we are at that peak.
Premier, I remember sometime last year you had also been infected with COVID-19. Having gone through the experience of having the virus, is that influencing at all your approach to how treatment for this virus should be taking place in the province?
Well, I must say that, before you get it, you see the recovery rate, you always think, well, let's just get it and get it over and done with. But ever since I've had it, my message to every single person is please do whatever you can not to get it. It is not a nice virus to get. I really felt it. I was in a bad way for 2 weeks. I'm also a diabetic, so that definitely had an impact on me. And of course, right now we can see it every single day. It is so close to us right now. We're losing so many people, so many loved ones at the moment. If you think about that first wave in our province, we took nearly 8 months to get to just over 4,000 deaths in our province. We've had 2,000 deaths, 2,500 deaths in the last 2 months. It really has. The peak is twice as high. The death rates are twice as high. The infection rates. So we've all got to do everything you can not to get it.
All right, Western Cape Premier Alan Winde, we're going to have to leave it there for tonight. Thanks for your time.